Okay, big welcome and thanks very much to everyone who's had to join us today for this information event, a really important piece of research on the career and educational journeys of care experienced young adults. My name is Carl McGrath. I'm the lead researcher on this study, and I'm joined today by my colleague Ashton Brown. And this piece of research is something that we're very passionate about, and we want to get as many people involved in as possible. So we're really excited to tell you about it. We just kind of want to use this as an opportunity to let you know about how to get involved, what the study itself is actually about, and then just to take any questions that anybody might have about the research itself. So just some quick housekeeping before we get started. This event is going to be recorded, and everyone that registered will be sent a link to the recording soon after the event ends. We've scheduled it to last about 45 minutes. So myself and Aisling are going to talk for about 20-25 minutes. Again, just to tell you why the study has been done, what it's focusing on, and then we'll explain who can take part in the study and how and why we'd like people to take part. And then if you have any questions or comments that you'd like to make, you can click on the Q&A button at the top, just beside where the chat button is. And you can post your questions or comments at any time during the presentation in there. And then at the end, we'll have about 15-20 minutes where myself and Aisling will go through the questions and any comments, and we'll do our best to respond to as many of the questions that are in there as we can. The questions, I think there's an option for you to post the questions anonymously if you don't want your name to come up with them. But you can also turn off that anonymous function, and if you don't want your name to come up, that's fine as well. So with that, we're going to just share some slides and start the information event. And I'm just going to start by quickly just introducing the research team and CES, just so you know who you are. I'm sure there's some people who got the invitation and hadn't heard of CES before. So CES stands for Centre for Effective Services. We're a not-for-profit organisation. We work across the whole of the island of Ireland. And as an organisation, we aim to improve people's lives by supporting the implementation of public services through evidence-informed policy and practice. And we usually work with government departments and service providers, and we support them to develop, implement, and then test or evaluate their policies and their services. Now, as for the research team, there's 6 of us on the research team, and there's a range of different skills and expertise across the research team. But we're also supported by 2 advisory groups who have been giving us really helpful guidance and advice so far. One group is made up of policymakers, and a second group is made up of service providers. And we'll come back to those 2 a little later to give you some more information on them. They're a really important key part of the study. And then just to tell you a little bit about myself and Aisling and their backgrounds, who are going to be our presenters for today. I've been a researcher in CS for the past 5 or 6 years. Before that, I was a social care worker for about 4 or 5 years, working with young people in residential care, emergency care and aftercare. And it was a role that I really enjoyed. So that's kind of part of where my own passion for this study has come from. In CS, we do research on lots of different topics and areas, and I've been waiting patiently over the last kind of couple of years for the opportunity to get involved in this area again with young people in care. So again, I'm delighted to be part of such an important topic, and that's trying to improve the lives and support for care experienced young adults. And I'll hand over to Aisling now, who's going to tell you a little bit about herself, why we're doing the study, and what it's focusing on.
Yeah, hi guys. Thank you so much for coming. I'm not going to lie, it's a little bit nerve-wracking watching the numbers go up on the screen. I think it's amazing to see such a response, so we're really grateful in terms of having you guys come on board for the information session, because as professionals who have direct links with young people leaving the care system, like, we would ideally like you guys to use your position and hopefully pass this on to care experience people that you know. So yeah, we'll be talking about a little bit more about that in a minute. And as Carl said, the research is somewhat unique in the sense that it has a lot of lived experience participation involved in the research design and the implementation of the research itself. So I'm on the project as a lived experience researcher, which means that I have personal care experience. I would have grown up in foster care and residential. I since went on to do my social care degree and worked in a mixture of residential and aftercare. I have a bit of a research and community research background, and very much value lived experience participation and people with lived experience having decision-making roles and being at the table. So when Carl got in contact to say that this is the research and this is the way it's structured, like, obviously it's something that I'm quite passionate about. So yeah, I guess from there, Carl, maybe we'll move into the conversation of the study. So why we're doing this study, and I don't know, in terms of maybe some of you on the Zoom meeting at the moment may have heard of the Care Experiences program, but if not, I'm going to give a small little bit of a background in terms of what it's about. So the Care Experiences program essentially is like a massive, big research project. So back in the day of the Ryan report, which I think concluded in 2009, it was a report that basically looked into institutional abuse that would have happened. And some recommendations made from the Ryan report was that there should be some sense of a longitudinal study done in terms of the outcomes of people that live in state care, let's just say, that there isn't really any longitudinal studies in terms of the outcomes of kind of where these young people go, the trajectories that they take, and maybe some difficulties that they face, and what like kind of supports actually like really work, you know. So that was a recommendation that was made like way back when, and unfortunately it was quite slow to be implemented, but we are here now because the Care Experiences program has been set up off the back of those Ryan report recommendations. So it is the program that will be running that longitudinal study. And I think the program is going to be running for a period of 10 years. It's kind of through the Department of Children, but it operates as a kind of separate entity in and of itself. Like, the funding is obviously sieved through the Department of Children to the Care Experiences program itself. And obviously that's a massive, big undertaking. So they're in the process of like really kind of drilling down some of the main foundations of what this longitudinal research will look like. And similarly, at that kind of central level within the program, there is youth advisory boards, people with care experience advising the research on that longitudinal basis, and also stakeholder research. It's a very, very exciting project, and in terms of getting something that big and that lengthy up off the ground just takes a massive amount of commitment and a massive amount of work and passion as well. And it would be just really interesting to see like where it's going to go and the outcomes that's going to come from it. But the great thing with that big, huge 10-year program is that there's funding for 2 smaller research projects every year. So the idea of the 2 smaller research projects will be to inform the bigger longitudinal study. So as it goes, it may ebb and flow a little bit depending on the outcomes of the smaller research projects. So how those smaller research projects are decided is that they go to the advisory boards, stakeholder and care experienced, and then they're voted for. So it's a very democratic system, I guess. And myself and Carl have been essentially the researchers that we're obviously going to be running the current research, which is looking at the educational and career pathways of young adults leaving the care system. And we are one of the first round of small research projects that are coming through the Care Experiences program, which is really cool to, you know, lead the way in terms of what that might look like and how it's structured in terms of our communication with the care experiences program, you know, the supports that we get from them, and that kind of like lived experience participation being built in all along the way. Because even though the bigger program for the longitudinal study has advisory boards, each of those smaller projects will also have advisory boards as well, and that's a point I'll get to in a few minutes. So yeah, it's really exciting, and obviously to be part of it is just like a really nice experience. And obviously I'm just very excited to be involved in it. And as Carl said, like, he's passionate about it because of his work, and I'm passionate about it because of my work and also personal experience. So moving on to look at the aims and focus of the research. So obviously we're going to be researching the trajectories of young people in terms of their pathways that they take from 18 to 24 in areas of education, training and employment. Education, training and employment, yes. And essentially we're like, the research will look at systemic obstacles and supports. Like, so systemic, I guess when we think about young people leaving care, we can kind of talk about them as if they're one homogenous group. But the reality is that they are, like all care leavers, take a very unique trajectory through the care system. And we have to respect that kind of individual journey. And there might be individual factors, risk and protective factors, in terms of where young people go in their training, education and employment. But what we know from research is that actually care leavers are really underrepresented in areas of education, training and employment. So when you have an experience where a whole population of people is underrepresented, well, then we have systemic questions to ask as well, you know. So as much as we are going to be looking at the individual risk and protective factors, we're also really focused on the systemic obstacles and supports. So, you know, those wider kind of systems that are in place, like what works, what do young people feel works, what do they feel is needed, you know, what supports them, what enables them, and what actually might act as an obstacle. So the systemic and individual, essentially the outputs of this research, we're going to be using it then to inform policy. At the end of the research, we hope to have a bit of a research launch and have key stakeholders at that meeting, and you know, that people will come away with something quite conclusive and informative in terms of looking at where we go next and how best to support these young people in their transition in education, training and employment. So the research questions that we'll be looking at are kind of, these research questions are very broad. They've actually been given to us by the Care Experiences programme. It actually came in the, I guess, like draft that we were given. So like the kind of questions that these act as, I guess, a scaffold or framing for us. So the first question, we'll be looking at factors which assist or act as barriers to engagement in further or higher education for care leavers aged 18 to 24. Then what factors assist or act as barriers to participation in employment or training for care leavers aged 18 to 24? And then what factors assist or act as barriers for service providers in assisting young care experienced adults in education, employment and training? So the survey, essentially we're looking at, the research is looking to engage care leavers, and the only criteria in terms of inclusion into the research, whether it's by survey or by interview, is that 18 to 24-year-old piece. So actually we have quite a wide criteria. In terms of the information or suggestions that we had from the advisory groups was around the age cutoff. You know, whether we could include people at 17 or whether we could include people over 24. And essentially we're framed by those broad research questions that have been given to us by the Care Experiences programme, and there will be probably other research outputs that look at maybe kind of further into adulthood or transitions from 16 upwards, like, you know. So as much as we have that one criteria, like, I can envision it being a lot broader in terms of the actual Care Experience programme itself. So me and Carol will obviously, because these are broad questions, we have to kind of look at how to get that output from the likes of a survey and our qualitative interviews. So we have kind of come up with like some sub questions under these three dominant questions. So yeah, that's kind of what guides the research and guides ourselves. Just in terms of our advisor groups, I know myself and Carol have already touched on it a little bit. So we've two advisor groups, one with lived experience. So these are young adults, and then another one with service providers and policymakers, which some of the logos are there in terms of who's included. The advisor groups essentially are there to advise us on things like designing and testing the data collection tools that we use. Understanding, we'll be looking later on to include them in terms of data analysis and understanding the findings that have come from the surveys and interviews. And then they've also kind of given us advice on how best to recruit participants for the study. And they'll also give us recommendations for policy and practice, which will come later. So we met with the advisory group, the care leavers advisory group, and also the service providers. And essentially, they really helped us build the survey and the interviews in a way that, like, particularly the young people, young adults actually, gave us great feedback on accessibility in terms of language, making sure that we kind of took our professional hat off a little bit and had language that was accessible to the young people that are going to be engaging in the survey and interview. Then, like, we just got some great advice in terms of how best to get the messaging out there that this is what we're doing. So yeah, if you have any questions on the advisor groups or anything like that, do shoot us a message into the Q&A. And I'm going to hand you over to Carl now, and he's going to talk about the rest of the survey in terms of how you guys can get involved.
Thanks very much, Ashton. Okay, so in terms of who can take part in the study and how, there's two main groups that can take part in the study. Okay, the first is care experienced young adults themselves. And as Ashton has touched on already, we have a really broad kind of definition and criteria for who can take part. So it's basically all care experienced young adults that are aged between 18 to 24 who have experienced any form of state care for any length of time in the Republic of Ireland can take part in the study. So whether they were in foster care, residential care, special emergency care, supported lodgings, it doesn't matter. Once they were in some form of state care is the main thing. And then similarly, it doesn't matter if they were only in care for a day, if they're in care for a year or 10 years, as long as they were in state care at some point. And then when we say all care leavers aged between 18 to 24, that also includes young adults who are in Tusla's care as unaccompanied minors or separated children seeking international protection. And then finally, we're especially interested in care experienced young adults aged 18 to 24 who are not currently in education, employment or training. So even though it's open to all care leavers aged 18 to 24 and we want as many young people within that group to take part as possible, past kind of research and studies have tended to focus on young people who are in education, employment and training. And that just means that the voice of those kind of young people not in education, employment or training either gets missed or left out. And so that's something that we just want to try and address as best as we can in this study. Secondly, then, the next group are service providers. And so this study is also open to professionals, staff, or management of services who support the education, employment, or training of care experienced young adults aged 18 to 24 in any way. Now, the reason we say in any way is because I know from my own kind of previous experience as a social care worker that even though education, employment, or training wasn't necessarily my area of expertise, or it wasn't what I necessarily supported young people with every day, it was still part of my role to try and support them to access and engage in education, employment, and training. So we recognise that there's lots of different roles and services that support care experienced young adults in lots of different ways with education, employment, and training. So we've intentionally kind of defined service providers very broadly to kind of let professionals decide for themselves if the kind of support that they provide is relevant to this study. And then in terms of how service providers and care experiencing adults can take part, I'll start first with service providers. There's two ways service providers can take part and can share their feedback, and that's by doing our online survey or joining one of our online focus groups. Now, the online survey will take about 15 to 25 minutes, depending on how many questions in it are relevant to you. And we're hoping that at the minimum, we can try and get 150 professionals to complete the survey. If more professionals complete it, that's brilliant. That's what we want. And it'll make the research have an even greater impact. But 150 is kind of the minimum that we're hoping to achieve. And then with the online focus groups, we'll be running 2 focus groups, with each lasting about 90 minutes. And we're a little bit more limited in the number of people that can take part in the focus group. So it'll be limited to about 10 people at most in each focus group, just so that everyone has time to talk and contribute. But the best way to sign up for the focus group is through the survey, or if you really don't want to do a survey, you can sign up separately for the focus group as well. And at the end, I'm going to put a link into the chat for where you can find the survey and focus group. For care experiencing adults, again, there's 2 ways that they can take part and share their feedback with us. So we have an online survey for them that takes around 15 to 20 minutes. And as Ashley mentioned already, the Young Care Leavers Advisory Group have been really instrumental in helping us put together the survey for care experiencing adults. We're also doing 30-minute interviews with 10 young people. So with the 10 interviews, the young people can decide if they want to do it online or in person. And then if they want to do it in person, they can choose the location as well, and we'll travel to them wherever they decide they want to do it. Now, to try and encourage as many young people as possible to take part in the study, we're offering vouchers as a kind of incentive and to compensate them for their time. So if a care experiencing adult does the survey, they can choose to enter a raffle where we've 7 one-for-all vouchers to give away that are worth between 25 and €100. So we're hoping that at least 60 care experienced young people aged 18 to 24 will do the survey. Again, if we can get more, that's brilliant. That only strengthens the impact of the research. And so we want as many as we can get, but 60 is kind of the minimum number that we're hoping to achieve. And then with the interviews, all 10 young adults who get selected for an interview will be guaranteed to get a €30 one-for-all voucher as well for their time. Now, just for anyone that takes part, the information that you share will be confidential, so only the research team will have access to it. But basically what we'll do with it is analyse all of the feedback that that people have given us, and we'll use it to make recommendations to the government, to different service providers, the policymakers, on how to improve education, employment and training supports for care experiencing adults. And we're hoping to publish and present the report with the recommendations by around February to March next year. And anyone who takes part in the study can sign up to be sent a copy of the report when it's ready as well, so that you can see kind of what recommendations your feedback is fed into. So if you go through the survey, at the very end, there's a question asking if you want to receive a copy of the report, the findings. Or similarly, if you just sign up to do an interview or a focus group, when you register, again, you'll be asked if you want to receive a copy of the findings at the end as well. So now that we've covered kind of who can take part and how you can take part, I'm going to end by quickly just kind of explaining why we want you to take part and to ask for all of your help to get the word out about the study. So if you're a care experienced young person, aged 18 to 24, or a service provider supporting them, we really want you to share your voice by taking part in the study and doing the survey, or doing the interview, or applying to do a focus group. There's a couple of different reasons why we think it will be to your benefit to take part in the study. Again, the information that you provide will be confidential, and the survey will only take most people probably around 15 to 20 minutes to do. The information and feedback that you share will help us to make recommendations on how to improve services and support for care experiencing adults. And then you'll also be guaranteed to get a copy, your own kind of personal copy of the study if you want to sign up for that. If you're a service provider, taking part is also a really good way to highlight the important work that you're doing. And then again, if you're a care experienced young person, you could receive a voucher worth between 25 and €100 if you decide to take part. Okay, but even if you're not a care experienced young person or a service provider, we still would love your help to spread the word about the study, to help try to kind of raise awareness and encourage others to take part in the study. And again, there'll be a link that I'll share in the chat that you can use to share with other services that you think might be interested and relevant, or care experienced young people that might be interested. And again, service providers and care experienced young people, even if you do take part, once you've finished taking part, again, we'd love if you're able to share the link to the study, encourage others to take part, and raise awareness about it. And just to give you an example of how important and how helpful that can be to us by people sharing and spreading the word. For this information session today, we had nearly 200 people register, which far exceeded how many we thought were going to register. But about 90% of those people weren't people that we had contact details for initially, which means most of you probably found out by somebody else sharing it with you. And so that's just an example of how impactful that can be if you are able to spread the word and share information about the study and the link to the study with others. It can really help us reach a much broader and wider audience than we're able to reach by ourselves. And so finally, just in terms of what's next, data collection is actually open now. So from today, the survey is open, so people can do the survey as soon as they'd like. Registration for the interviews is open if any care experienced young people want to put their names down for an interview. And then similarly, registration for focus group is also open if there's any service providers on the call that are interested in registering for the focus group. Our window for collecting data is about 6 weeks. So the 19th of September is when the survey will close, and the interviews and focus groups will hopefully be completed by that time as well. Okay, so I'm going to stop sharing now, and we'll start to take a look at the Q&As.
So Carl, I've just been replying to a few people in the Q&As. So there's one question in terms of whether or not the research includes people with disabilities. Absolutely, we want to hear those voices. That's obviously a unique experience in terms of trajectories post-care in the EET domain. So yes, we absolutely do want to hear people and hear from people with that particular experience, and then just in terms of the second question was just around whether or not there will be qualitative research. And obviously we are running the qualitative interviews, but we're limited on the numbers due to the small scope of the study. And another one, which is a really good question, is are we including informal care arrangements like kinship care and alternative care? So Carl, I might let you answer that one, yeah?
Yeah, that's fine. Kinship care are eligible to take part. And what was the second one, Aisling? Alternative care?
Yeah, well, like kind of that kind of maybe alternative kind of kinship arrangements. But yeah, I think we from early on, because we had one of our young people on the advisory board who was in an arrangement, and essentially we were saying that was going to be included.
Yeah, kinship care is eligible. Yeah. Okay, that's great. Sorry, no, I'm just working my way. So thanks, Kirsten. Just put in the comment. They're a very important researcher, or very important research. I'm a social worker at Trinity College Dublin and work with a few care experienced young people. They're definitely underrepresented in third level education and face complex issues and barriers. That's a really good point. Thanks for that. Does it apply to young students in special schools who are 18 too? I think is that the one you covered already, Aisling?
Yeah, well, like anybody with care experience, including kinship, just like once they turn 18, they're pretty much eligible, 18 to 24, to engage with the study.
Exactly. Yeah.
Really, the only criteria is between 18 and 24.
Yeah. Once they've had experience of any type of kind of state care, that's fine.
Yeah.
And how are you ensuring? Go ahead,
There's a question just on the scope within the research to explore the impact of cultural and language barriers faced by care experienced young people who are not native English speakers. So obviously we have like a focus in terms of unaccompanied minors, and like we have tried as best as we can to make the survey as accessible as possible in terms of using simple English. But we do understand that language may be a barrier in terms of engagement with the survey or interview, but there is scope for them to talk about language as a barrier or culture as a barrier. And it'll be really interesting to see the outputs of that when we move to data collection. But just in terms of like professionals who are working with unaccompanied minors or unaccompanied minors that have turned 18, like they may need some help in terms of navigating the survey. So just maybe understand that and maybe be on hand. And like obviously we would have loved, like we did speak about having the scope to maybe translate the survey like into different languages and stuff like that. But it's because the research is only running for a year and we're on a small enough budget, like it would have been a bigger output in terms of being able to do that, like, you know, so we just had to focus in on really plain English. And yeah, I hope I answered that question.
Yeah, and just to add to that, Aisling, so on our advisory group, thankfully we do have 2 young people who are unaccompanied minors, and they have been able, their feedback's been really helpful to us in making sure that the survey is in plain English and understandable. Now, it is possible for young people to have, if they want someone to assist them to complete the survey, if they're afraid their English isn't going to be strong enough, that's fine. If there's a trusted person that they want to ask to help them do it, that's fine. And they can also contact myself. All the information materials that we have about the surveys have my contact details on them as well if they want to contact me, and I can help as best I can, try and talk them through it. In the surveys, we have some specific questions just for unaccompanied minors as well, because some of the barriers are slightly different for them. And then similarly in the service providers survey, there's also a short specific section for service providers who work specifically with unaccompanied minors. Again, just to try and capture some of those kind of distinct, unique kind of barriers that they face as well.
And then just 2 last questions there. Can young adults, when filling out the survey, take breaks during and answer some bits and come back, or will it have to be all done in one go? Carl, you know this survey.
Yeah, so that's a really good question. So unfortunately, they can't. The platform that we're using is MS Forms, and that doesn't allow you to stop halfway through, exit it, and then come back. Now we have put in a note at the beginning of each survey to say that we recommend that you try do it when you know you have, say, 15-20 minutes spare, and do your best to try and complete it in one go. If you keep, as far as I know, if you keep the tab open and don't close it off, it should be fine. I think you'll be able to pick up from where you left off. But if you close the tab before saving the survey, it won't save your details, and you'll have to come back and do it again. And that's the same for service providers and young people as well.
Yeah.
As I said, we try to put that note in at the very beginning just to let people know that is something to be mindful of when you're doing it.
And then just on the qualitative in-person interviews, can a person take a break? So the thing is with the survey, like we've tried to really condense it down so that it should really only take 10 to 15 minutes to complete, because obviously any longer than that we might lose engagement. With the interviews, we have said that they'll take up to 30 minutes, but if a young person needs a break, or if the interview runs a little bit longer, well then so be it. We kind of just put a 30-minute framework on it so as not to maybe overwhelm a person who might want to take part but maybe thinks an hour is too long or whatever like that. But me and Carl are obviously going to be hosting the in-person interviews, and we'll be very flexible just in terms of meeting people's needs and stuff. So
okay, there's another question there I don't think we've we've got to yet from that asks, how are you ensuring the sample includes diverse care experience voices, including separate children, migrants, disabled care leavers? Will there be disaggregated analysis of data by ethnicity, gender, or care setting? So I think we've touched on the first part of the question. Just in terms of the analysis, we will try and disaggregate some of the analysis as best we can. There'll be certain limitations to how much we can disaggregate just because of the amount of time that we have to produce the findings. But we are planning to disaggregate some of the analysis by ethnicity, gender, and care setting, just to see if the trajectories differ according to some of those kind of factors. So that is something we'll try and do as best we can.
Just one more question is, does it apply to young students in special schools who are 18 too? So I'm not too sure what you mean by special schools, but say if somebody pre-18 has been on a voluntary care order or a full care order or a kinship arrangement with Tusla, and they will be able to take part in the study.
Yeah.
But yeah, I hope that answers all your questions, and I hope me and Carol were thorough enough. But our emails are open if anybody has thinks of any questions afterwards. Like, do let us know. And obviously, we would just like to encourage you guys to, when the survey goes live, I think it's live today, Carol, is it?
Survey is live today. I'm just going to get the link and pop it into the chat for where people can.
So now that you guys are well versed and there's 98 people left online, those 98 people are going to click into the survey for the stakeholders, and you guys are going to do that survey immediately off the back of this meeting. And then if you guys could also obviously forward the survey if you're working with any young adults from age 18 to 24, if you can pass on the survey link to them as well, and encourage any care leavers that you are linked with to obviously complete the survey. We would be very, very, very grateful.
Yeah, just before we go, Aisling, I think there's still one or two questions coming in that we haven't got to. Daniel McFarlane, really exciting project. I'm very happy to support my role. Will this research project involve engagement with any forms of quantitative data to add to the rich experiential data reported via participants? We have good examples of what is working and current plans for better inclusion of care experienced students via NAP access routes and the new access data plan. So we will, there will be quantitative data as part of the study. The survey itself is one place where we'll get quantitative data. Something we didn't mention is that we'll be doing a little bit of secondary analysis of quantitative data that's publicly available. So the CSO, the Central Statistics Office, had published some data on the kind of education outcomes of young people aged between, I think it's 18 to 23, that were in care. So we'll do a little bit of secondary analysis of that data as well, again, just to add to the qualitative data that we're getting through the interviews and focus groups, and then we'll bring all that data together again when it comes to trying to make recommendations.
Our literature review as well is looking at Irish sources and also some international sources. So that will kind of be built into the literature review as well. So
yeah. Okay, is there space in the surveys to capture the impact of trauma, displacement, and disrupted education? So in the surveys, we don't ask specifically about trauma. So the surveys, we try and focus a little bit more on those kind of systemic factors. So the questions are a little bit more around the systems, services, supports that people are getting. We do ask about displacement and disrupted education in the survey. The interviews are probably where we'll have a better chance to explore topics like trauma and if and how they may have impacted people's trajectories. So the interviews will give us a little bit more scope to go into those more kind of individual level factors, whereas the survey we've tried, just to be able to limit it to 15, 20 minutes, we've tried to focus a little bit more on the kind of questions about the systems, the services, the supports that young people are receiving. Okay, there's a question here from Catherine Carty. Very exciting project. Congratulations. A very good point there regarding the timeline. Our first years are only starting on the 15th of September. Is there any provision to extend the timeline for data collection? Okay, I was actually wondering when we were going to get this question. The honest answer is I don't know. So we have tried. So we've set the deadline as it is already for the 19th of September. We were aware that will put a little bit of pressure in terms of timing for some people coming back into college and back into education and training. So we basically will have to see in terms of what kind of response rate we get initially. If it gets to the 19th, we have a low response rate and we think we probably just need to give another week or two to give people more chance to do the survey. We'll probably look at it at that stage and we'll let people know if we have extended the deadline or not. But to begin with, the deadline is the 19th of September. We're going to try our best to work with that. And the reason for that is just so that we can meet all the other deadlines that come after that for us in terms of writing up the report, making our recommendations, having them reviewed by different stakeholders, and then being able to publish the final report by February, March next year in time for some stakeholders to make decisions and build a report and the recommendations into decisions that they might be making about policies and their services and things like that.
And then just another question then, does the survey provide opportunities to reflect the journeys of care experienced young people who have simultaneously been involved in the criminal justice system? So, Carl, did we ask specific questions around involvement in criminal justice?
Yeah, so one of our questions does ask if you've had criminal justice involvement, and we would basically just, again, use that kind of question to compare whether there's any differences then in education trajectories if you've had involvement in the criminal justice system. We don't ask too many more specific questions in the survey itself after that about criminal justice involvement. But again, when it comes to the interviews,
yeah,
that's another place where we'd be able to dig into that in a little bit more
but
detail.
Also, as much as the survey is questions on like kind of more qualitative or quantitative data in terms of questions of like yes, no, and tick the box kind of stuff. But at the very, very end, we have included space in terms of, I think there's 3 qualitative questions to just ask young adults, like, you know, tell us like what maybe specifically worked for you. And I think we might capture a little bit of qualitative from the survey, and that might be where somebody has put in they're free to kind of put in those experiences. And then obviously at the end of the survey, like if we have a number of young people that have decided that they'd like to take part in the interview, well, we will try our very best to sample as many different experiences as we can so that we get qualitative information that represents maybe somebody with a disability, somebody from an unaccompanied minor background, somebody who has previous engagement in the criminal justice system, and we'll try and make that sample population for the qualitative collection as multifaceted as we can.
Yeah. So just to note, I realise we're just past 2:45 now, and we had planned to end at this time. There will be a recording, so myself and Ashton will continue to work through these questions. If you're somebody that needs to run, if you have a question that we haven't got to yet, or that you haven't popped into the chat yet, pop it in, and we'll answer it. And then when you get a copy of the recording, you can fast forward to this bit and check the answer that we've been able to give to.
Just lastly, we've had to go through the ethics approval process with Tusla, and part of that ethics process, we have built in kind of safeguards and procedures for people engaging with the survey and also with interviews as well. So that's been well thought out, and we've got ethical approval now for the study to proceed forward.
Yeah. Okay, there's still questions coming in, so you see, I want to make sure I get through them all. So Katrina Carey has just said, very interesting and important work. Can you share a blurb summarising the research project, which would explain the project to share with young people? I work in fostering and would like to share information on the survey with our social workers to pass on to young people. Thanks. So Katrina, I'm actually, again, I'm going to send out everyone that has registered for this. I'm going to send out an email shortly after this, and I'll have flyers attached into it, one for young people and one for service providers. The flyers are a bit more user friendly. They'll have a link and a QR code to where people can go to do the survey and the interview. So I'll try send that out either later today or tomorrow to people who are here on the call. Okay, Olivia Farrell, does the survey put up June? Okay, yeah, we've got to that one. Okay, Colin McNamee then has asked, why 18 plus only? What ethical considerations of the survey can curtail under 18-year-olds participating? So Colin, the 18 plus basically is linked to the research questions, which were something that were given to us. So the care system, once somebody turns 18, they move from care to aftercare, and the system and the supports and the services tend to change at that stage. So under 18s, with the time and the budget that we have to do the survey, we could probably only really address under 18s and over 18s with two separate studies nearly. And for this particular study, we've been asked to focus specifically on over 18s. Now, the decision for that would have come from the broader advisory groups of the care experiences program as a whole, and so this was an age group that was, I suppose, seen as a priority for this kind of research on education, employment, and training at this particular moment in time. Okay, kind of like, I get what you mean. Aftercare starts at 18, so the planning, you're right, the planning does start at 16, and young people can move into aftercare before they turn 18. So I take that point. Thanks for the correction. Okay. How can frontline workers contribute towards the research, particularly those working with separated children / unaccompanied minors? So again, the survey and the focus group for service providers is one way, and that's a really important way. And then the second way is by sharing information about the study with your colleagues and with care experienced young people that you're working with. They're really the two best ways that you can help with the study. And then Paula Rogers is asking, support workers sit in with young people for the qualitative one-to-one interviews if young people would find that supportive, and will researchers come to where the young people are so they're comfortable in place that interviews take place? So yeah, it's a yes to both of them. Paula, if the young person wants someone to sit in with them, that's perfectly fine. We've no issue with that. And we will, if the young person wants to do the interview in person, we will go to them, whatever location they decide they want to do it in. So we'll be flexible, as flexible as we can with that. Okay, and then Edel has asked, thanks for the presentation, Karen Lashling, and apologies that I attended late. This may have been mentioned at the beginning of the presentation, but is there a brief snapshot or infographic / poster that we can easily share to care experiencing adults for the information through text email? There is, so as I mentioned just a couple of minutes ago, there are flyers that I'm going to send out, hopefully before the end of today, or if not, early to tomorrow, which you'll be able to share with young people. Jared Gallagher has said, we will do our best to promote it. It is a shame there wasn't another week or two on the deadline, as colleges are largely back towards the end of September. Okay, that's a good point. We're going to take that feedback away with us, Jared. And as I said, at the moment the deadline is 19th September, but if that changes, we'll let people know if we are able to extend it by a week or two. Let's see, is there scope within the research to explore the impact of cultural and language barriers faced by care experienced young people who are not native English speakers? So I think you touched on this one earlier already, but yeah, there is. In the survey, we ask questions that try and dig into cultural and language barriers faced by young people who aren't English speakers natively. Okay, I think we've possibly.
I think my Q&As for some reason are a bit jumbled in terms of what's come in. It's not going in order of time, I guess. So I can't see, like I can see ones that are answered, but not ones that are kind of have just come in. But I think like we've kind of covered majority of questions. But as we said, if you think of something afterwards and it's a burning question and you badly need it answered, by all means do get in contact with myself and Carl. We're happy to answer any questions.
Yeah, exactly.
And as we said, a copy of this presentation will go to your emails after. If we've managed to set it up right, we hope it does. So somebody let us know if that's actually occurred. And yeah, like as if you can just definitely pass on to your colleagues and to your young people as well, the links for the survey. Like as we said, we'd be very, very appreciative. But thank you so much for coming. Like we're very grateful, and this will be so helpful because our data collection is just such a small window. And we definitely, in terms of getting as many people and participants as possible, like we are relying on word of mouth and stuff. So you guys serve a really important purpose to this research, and we really appreciate it.
Yeah, and just to echo that, and very quickly, Sheila Barra, yes, we will share links through the national CIPSI network. So hopefully CIPSI coordinators will be sent the links as well. I think that's the end of the questions, or that's all the questions that we have. Just to echo Aisling, a massive thanks to everybody who took the time to attend this. We really encourage you to do the survey, register for a focus group, share the links and resources with young people when we send them out, and encourage as many young people as possible to take part in the study if you can. If anybody has any other questions that they want to follow up with after this, you'll have my email. Feel free to send them on at any time. Okay, we'll leave it at that. Thanks very much, everybody.
Thanks, guys. Have a good day.
Bye bye.